I'm Heather Gates, and I'm the CEO of Community Health Resources. We are a behavioral health provider, and we receive funding from the State of Connecticut, Department of Children and Families, Department of Mental Health and Addiction Services, and a number of other agencies. We serve some of the most needy children and adults who have mental health and addiction treatment issues. It's widely recognized that community-based care is the most cost-effective and efficient means of providing vital human services. The system is an essential part of health care in Connecticut and part of the solution to our ongoing fiscal problems. Despite this, Connecticut state government has, as you so articulately stated, underfunded us for many, many years. And we're hoping that if you are elected governor, you'll take a different approach by working to end the policy of balancing the budget on the backs of those we serve, the people we employ, and as important, our communities. And so we would like to ask you how you would support and strengthen the community-based service system rather than continue to weaken it.
Well, one of the things I said last August is that I would have a community not-profit and not-profit, community provider and not-profit human services cap, and that I plan on creating the equivalent of a commissionership to manage the relationships between the state government and your agencies and agencies that may not be represented in the room. I do that because, listen, any group of people who are providing direct services to maintain 500,000 people, whether you're a state agency or not, you're dependent on this very important and, under my administration, valued relationship. Somebody needs to be managing that on behalf of state government, and not in such a way that the state agencies currently manage it, which is to figure out how they can slow down your payment so that they can have a balance in their account. I mean, if we can pay our employees every week or 2 weeks, we should be paying you within a reasonable period of time. 30 days would certainly be the goal. And by the way, those portions of the money which are predictable should be